I'm Larry Ahrens, and once again we're with Dr. Harvey White. Dr. White is the founder and executive director of Vessel Health here in New Mexico. And Harvey, we're going to talk a little bit about varicose veins. That's a term that's used quite a bit. What is a varicose vein?
Well, you know, in the last session, Larry, we talked a little bit about what I call venous hypertension.
Right.
Extra pressure inside the veins. And I also mentioned that veins are thin. They have a very thin wall, and consequently they can dilate or stretch. And classically what happens in varicose veins is that pressure from the blood column that extends from the heart to the feet stretches the veins, and they show up on the surface of the leg. That is classic varicose veins.
Now, you can have them, and I've got them on one leg, but I don't have any pain as a result.
Right, right.
A lot of patients you see do have considerable pain from this.
There is a whole spectrum of issues that can derive from venous hypertension or excessive pressure in the legs. And those can range from very minor cosmetic issues we call spider veins or reticular veins, very tiny, more visible in women than men, to varicose veins that are dilated and ropey that may cause no symptoms. In the last section, I mentioned a bit about some of those symptoms that can develop. Those symptoms that can develop include things like pressure, heaviness, even some swelling in the legs. And as we move down that spectrum, if that venous hypertension goes on long enough or is problematic enough, then the skin on the surface of the leg begins to change.
In what way? What does it look like?
That's an interesting topic. What happens actually is that because of the pressure in the blood vessel, some of the blood is pushed out of the blood vessel. It actually leaches out, goes right through the pores of the blood vessel. And some of those blood cells, the red blood cells, break and dissolve, and they have iron in them. So one of the first things that happens is we develop brown pigmentation of the ankles and lower legs.
Interesting.
It's actually iron in the skin.
Wow.
And it's very hard to get rid of.
So if you feel like you're having a problem or this is a potential problem, what should you be aware of first in terms of, before you seek medical attention?
Well, I think that the first thing to be aware of is your family history. If you have a family history, and if your mother or your father had varicose veins, likely you're going to have trouble, and you could look to see how they did in life, you might say.
Right.
And if they develop problems as they aged, then it could happen to you. So the thing we look for first are those symptoms. Then we look for skin changes or cutaneous changes that develop. If this progresses, the problems get much more apparent, though. One can develop more prominent swelling of the legs, inflammation or erythema, where the leg becomes quite reddened. And then even in the worst case scenario, we can get ulcers where there's breakdown of the skin.
Now, what's the good news? You can take care of this ahead of time, right?
You can. And let me just, before I was just thinking, on this topic of ulcers, I mentioned the iron that gets in the, into the skin. Well, what happens is that tissue does not heal well. So once we get to that problem or that point, then the ulcers or skin breakdown is tough to take care of. Let me mention, though, also, we work in an organization I call Vessel Health. And we take a very clear health perspective.
Right.
That perspective, to me, Larry, involves not only, let's say, attending to issues, but it involves also the fact that it's the way we see ourselves that really creates health. And so even if these issues are cosmetic, they're minor to some people's eye, they can affect the way you see yourself, and they can affect the way you invest in your health. And we feel it's very important to invest in our health as we move forward in age.
So if you'd like to find out more about your veins, varicose veins, and potential problems, this would be the man to talk to, Dr. Harvey White at Vessel Health. How do they find you?
I mentioned our website, and I'll tell you about it again. It's www.vesselnm.com, and we have sections on these various areas: arterial health, heart health, vein health, and they're worth looking at. We can also be reached by phone. That's 505-828-3000, and we're available most all the time, Larry.
Thank you, Dr. White.
Appreciate it.